Hi, welcome to Aidsfonds.
Hi everyone, I'm Coriette.
And I'm Anna.
This is a video about the research we did in HIV in South Africa for our master's thesis. The focuses were on PrEP and on self-testing. We went to South Africa, we visited Pretoria and Johannesburg, but also Cape Town and Durban. And while we were there, we talked to a lot of people. We spoke to activists, researchers, peer educators and health professionals. We learned a lot from them, and then we went back to the Netherlands where we did interviews. So now we're going to be presenting our findings.
I did my research on HIV self-testing and its suitability for the South African sex work community. Self-testing is a way to test yourself for HIV. You can do it either through blood, taking some blood from a fingertip, or with an oral swab in your mouth. At the moment, self-tests are on sale in South Africa, but they're not regulated by the government. I wanted to find out whether self-testing would be a good intervention for sex workers and what healthcare professionals and peer educators thought about it for sex workers. My findings are as follows. The first main point is it's very important to have a good understanding of HIV when taking a self-test, because it requires the tester to independently go to the clinic and then seek treatment. A lot of people that I spoke to were worried that maybe most sex workers don't have the correct information about HIV prevention and also its treatment. The second point is that counselling was found to be very, very important to the people I spoke to. Counselling was seen as a way to, first of all, inform the person testing about HIV, and also it was seen as a way to calm the person and give them emotional support. Therefore, without counselling, people were quite concerned about people's well-being testing alone, and also they were worried that they wouldn't seek treatment without that support. The third point is about the perceived advantages of self-testing. People said that the privacy and confidentiality of a self-test were the best parts about it. However, this is linked to the fact that sex workers often don't have private or confidential healthcare, especially in government clinics. I heard stories of negative attitudes towards sex workers, abuse of sex workers, and this really prevented people from going to the clinic. Therefore, while privacy and confidentiality may seem like advantages, the underlying problem of unequal access to care is still an issue. So, based on my findings, I have one main tip for NGOs and service providers, which is that I would only recommend self-testing be implemented in areas where there are sex work friendly clinics and teams of peer educators or community-led organisations. Peer educators should be taught how to operate self-tests, and they should always give pre-counselling to those who they give a test to. The packaging of HIV self-tests should always include the National AIDS helpline, and in sex work friendly clinics perhaps a sticker could be put onto them which includes a line specifically for sex workers. I have one key message to policymakers, which is that the decriminalisation of sex work will definitely pave the way for more equal access to healthcare.
At first you put your arms around me, then you put your charms around me.
So my research was about PrEP. PrEP stands for Pre-Exposure Prophylaxis. It's a drug that you can take every day that can prevent you from getting HIV. PrEP is now in South Africa only being distributed to sex workers, and it's a new drug, so that's why it's important that we do research on it. My first finding regarding PrEP was that good healthcare access is essential for accessing PrEP and getting information on PrEP. Unfortunately, sex workers often don't have good access to healthcare, which means they get their information from peers or from other people. There are a lot of rumors about PrEP that I've heard about, some about side effects being really bad or that it's actually a bad pill. These rumors can lead to sex workers making their medical decisions based on wrong information. So my main finding is really that it's very important to have good healthcare access for good information. My second finding is really one about access to PrEP. I found that even though PrEP is supposed to be available everywhere, it's only available at a limited number of clinics and pharmacies. So even if you are informed on PrEP and you know that you want it, it can be difficult to get the pills when you're traveling or if you have to take it for a longer time. My third important finding is that in addition to healthcare access and PrEP knowledge, it's important that sex workers feel safe and feel that they can trust PrEP. Right now there's stigma on sex work and on HIV, and this is extended to PrEP use. Since it's only distributed to sex workers, they may feel like it's hard to trust that there's something exclusively for them, and it can also be that they're afraid of people discovering that they're a sex worker because they are taking PrEP. This can happen in clinics when they're asking for PrEP, that people can assume that they are sex workers. But it can also happen in a setting at home when you're taking a pill and some of your family members ask, what's the pill you're taking? Or other people you're living with who don't understand PrEP. This can make it very difficult to feel comfortable taking PrEP and being able to use it. So my last finding is a very positive one. Sex workers who are on PrEP report that their PrEP makes them feel very safe, that it makes them feel protected, and that it allows them to take responsibility for their health. So that's a very positive finding. So the first tip I have is for sex worker-led organizations. We know you've been doing a lot of sensitization efforts in clinics. The tip is really keep up the good work, because healthcare access is very important if sex workers want to use PrEP. More people need to know about PrEP so it can be discussed and accepted. More acceptance of PrEP will make it more normal and easier to take. My third tip is about education. If you want to know how PrEP really works, just go and ask. Go to your clinic, go to peer educators, look it up and make sure you get the right information.
So we want to say a really big thank you to everyone who's helped us along the way. That includes WITS RHI and especially the peer educators there at the Esalen Street Clinic. We want to thank North Star Alliance and the peer educators at Kempton Park. We want to thank Sweat and Sizonka, who allowed us to join the Creative Space sessions. And we want to say a big thank you to our supervisors who have given us so much guidance and support.